happy welcome here. Well, we are here for the Leopoldina meeting. I'm very happy. My name is Claudia Spies. I'm happy that you're here together with my co-chair, Joseph Kesioklu. We want to give the introduction. Detlef Ganten could not come. He is seriously ill, so he has a high fever and cannot really join us. So from the Leopoldina and from Detlef Ganten, I will tell you that he greets you, everybody greets you, and you are very welcome here in Berlin. He says he has a high interest in this topic because the Leopoldina-Symposium and the topic we have give patients a better view, a patient-centered outcome, and an avoidance of problems patients and relatives have after ICU stay. So from post-intensive care unit, we have 25% of the patients who suffer from long-term illness. This long-term illness has serious devastating effects on families and on patients in the long run, and many of them need your help here as a team to really improve that. And from the Leopoldina, the DGAI, the DGF, the SEChem, and the DV, where is Christian Weithas is here as a representative, and Bernd Swissler is here. Maybe you'll join us here, come down here. No. And from the DGF, who is here? DGF, from the colleague from the nurses. Okay, maybe you come down here and join with us here this meeting, because I think it's very important to see that as a team approach. We need multi-professional tasks, we need multi-professional help, we need help from the companies. The companies, thank you for supporting that together with the Leopoldina. We need to close the gaps for the patient's sake. I think we have a lot of gaps. We cannot really well mobilize the patient in the ICU. Needs a lot of efforts of the nurses to do that. So I hope we get better products at the end to do that. I think this is worth a discussion on that. And I think we need better pharmaceutical drugs. I think many of them have sedative effects, and if you need an anxiolytic agent and to avoid long-term consequences, I think you have these sedative components. This will be discussed as well, because we have better drugs on the run, and I think this needs to be developed very early in that stage. And I hope with that we can avoid PICS. And for the PICS thing, I think it's very important that post-intensive care syndrome has cognitive, has physical, and has mental consequences. And these are so problematic for the relatives as well as the patient that we want to change that. I'm very, very happy that, and I'm very grateful that patients really help us to understand that, because it's only the patient who can give us the insight from that what we are doing. And I think we did not talk so often the years before with the patients, and I think it's great that we have two patients who really help us in that setting to understand that in the beginning, and we have a relative at the end of this meeting where we want to discuss with them how they experience that and how we can change our behavior together. And I hope at the end we will improve our daily doing. And I know we have great teams all over the world, and together we can join this approach really to avoid long-term consequences. So I'm coming to Joseph, and Joseph will help me with that.
Thank you very much, Claudia. For the first, I would like to say how glad that, I am to be here, and also as a representative of European Society of Intensive Care Medicine, But I would like to really go back some 70 years for a brief period when the ICUs were first emerging during the polio crisis in Copenhagen. And then it became an institution. And in the coming 30 or 40 years, and I can give you my personal experience, when I started the training in 1980, we were concentrating on the respiration, circulation, infection, and that was it. And we were extremely happy if the patient survived and went out of the ICU, and actually nobody talked about the patient thereafter. And we didn't know anything what happened with the patient. Sometimes they were coming back, then we were informed about it. Now you see that the last 15 years, increasingly, we have started to concentrate to the well-being of the patient physically and mentally, and also of the family member after discharge of the ICU. Claudia has given a very important figure, 25%, and nowadays most of us increasingly are following the patients after being discharged from ICU, and you see actually a lot of things there. And I'm extremely happy that we have a lot of research directed to this problem in the last years, and that's why I am feeling very privileged to be here, because this symposium has done something very important, mainly concentrated to the aftermath of the intensive care stay. I hope this will be a very nice 2 days event, and we will learn a lot. Thank you very much.